Health authorities on Thursday disclosed that they have received the reports of doctors not properly attending to persons who seek care and treatment at the public hospitals, but are instead neglecting their duties to tend to their private practice. Health Minister Dr. Frank Anthony, during Thursday's daily COVID-19 update, pointed out that this kind of behavior is a violation of the health personnel's obligation to the public healthcare system. As such, the ministry will be investigating the claims.
That we have a number of doctors who have been employed with us who would come in, they spend maybe an hour in the hospital and then they run away to their private practice. This is something that we are working to curb because they're not serving the population in the public health system for which they're being paid. And if trying to correct that is making some people uneasy, and if it's making the opposition uneasy, well then I'm happy to make them uneasy, because these doctors must first of all be there and serve the patients of the public institution. And I don't make any apologies for that.
Dr. Anthony, when questioned about claims made by opposition leader Joseph Harmon at a recent press conference of several doctors resigning from the West Demerara Regional Hospital, pointed out that in the last 3 weeks, just one resignation was received.
I have asked the authorities at the West Demerara Hospital whether or not they have received any such resignation. I'm told that about 3 weeks ago, one doctor had resigned. As of today, we haven't received any resignation from any doctor. So whatever it is at this point in time, we haven't seen those resignations.
Leader of the APNU-AFC opposition, Joseph Harmon, during a virtual press conference on Wednesday, announced that a crisis has hit the health sector.
This morning, I learned that 8 doctors would have left the West Demerara Regional Hospital. Whether they have resigned or they just walked off, I'm not quite sure. But my understanding is that they have said that they've had enough. They're overworked, they're underpaid, and they're treated as if they were not frontline workers by this regime. More importantly, by the regime, the administration in Region Number 3.
Shadow Minister of Local Government and Regional Development Ganesh Mahipal took to his Facebook page on Tuesday, highlighting a number of issues affecting healthcare providers at the institution. According to Mahipal, the hospital is experiencing a shortage of doctors and medications. He alleged that 8 doctors from the hospital resigned on Tuesday, March 30. The Member of Parliament further alleged that the lack of adequate human resources has forced the remaining doctors to endure double workload. Commenting on the issue of drug shortages, Minister Anthony said that his ministry was recently tasked with disposing $10 billion worth of expired medications allegedly inherited from the opposition. APNU-AFC has since denied hoarding expired medications, citing that this situation existed years prior to them attaining office in 2015. Meanwhile, with each passing day, hundreds of persons continue to receive COVID-19 shots to aid in their defense of developing severe symptoms of the disease. As of Wednesday, in excess of 36,000 persons were immunized. The ministry is concurrently administering first and booster doses to eligible persons. Guyana is expected to receive a consignment of 25,000 doses of the Russian Sputnik V vaccine via the Chedijagan International Airport on Friday. Timeka Rodney reporting for the HGP Nightly News.